The Health Index measures the extent to which a country's citizens are healthy and have access to the necessary services and resources to maintain good health, including health outcomes, health systems, illness and risk factors, and mortality rates. Thailand, with a population of 66 million people, has a health index of 77.2. It fares better than many of its Western counterparts, such as Norway, the United Kingdom, and Switzerland. This Southeast Asian nation can be considered as a model in terms of its healthcare system, not just in the Asian region, but in the world at large. So how did this upper middle income Asian country's healthcare consistently rank among the best in the world for many decades? A massive chunk of its successes in this field was made possible by the active participation of its dedicated medical professionals, especially those in rural areas. Reforms implemented in the Thai healthcare system became possible because of solid political networks associated with the Ministry of Public Health. These networks are mostly a loose grouping of people with occupational positions, sharing similar values and have considerable influence in policymaking and politics. They can be described as autonomous because they have their own agendas, act independently to advance these, and are not aligned with any political party. Autonomous political networks, such as networks of rural doctors, nurses, and pharmacists, have consistently played a huge role in Thai politics and healthcare policymaking. The current networks of rural health professionals were a product of their political awakening during their university years in the 1970s. Back then, these young professionals were exposed to global policies and resolutions, such as China's Barefoot Doctors Model and the 1978 Declaration of the World Health Organization on Primary Healthcare. These inspired them to instill change in the Thai public health system. Perhaps what strengthened and deepened these healthcare professionals' passion and dedication, especially in the rural areas, was the national government's imposition of public service through practicing in rural clinics and hospitals for 3 years in exchange for the state's subsidy in their tuition. This service paved their way to witness the harsh realities and inequalities of the Thai healthcare system, particularly the huge resource gap between urban and rural areas. Some 50 years on, this social movement follows a loose and fluid but highly effective relationship between government agencies and NGOs, resulting in a thriving and healthy citizenry. To date, the fabric of Thai society is witnessing a significant transformation with the rise of youth activism challenging traditional political and social norms. Isn't it exciting to see where the current generation of Thailand's youth will take their activism and engagement to uplift people's lives and improve their country?